First Alert 4 is following the money when it comes to how opioid settlement dollars are invested across the St. Louis metro. We told you recently St. Louis County hasn't spent any of its $16 million it's received. Now First Alert 4 Investigates has uncovered another local government raising questions about how it's using its settlement dollars and has residents sounding the alarm.
DeAndre Buckner was a star running back at Kirkwood High School, helping lead the Pioneers to the playoffs in both 2007 and 08, with his sights set on playing the game in college.
I felt like the star's mom. Yeah, he was recognized everywhere we went, and he was a joy.
His mother, Angela, says when he was redshirted as a freshman, her son spiraled, turning to heroin to fill the void.
I didn't know how to get him to stop. I didn't know how to help him.
He dropped out of college, and at 25 years old, DeAndre died of an overdose in 2015.
That's how I remember him, is with a smile on his face.
Angela says Kirkwood lacked resources to support those fighting addiction, despite its affluent reputation.
It doesn't have a face or a color or an income bracket. It's everywhere.
Key details on where opioid settlement funds are spent do not always make it on reports to the state. It took a separate request from First Alert 4 to find out an alternative response vehicle was actually this Ford F-350 truck with department decals and a brand new snowplow used by the fire department for inclement weather.
No, it doesn't make any sense. I think it should be put back and use what it was intended for.
Kirkwood Fire Chief Jim Silvernail tells us that snowplow truck is used for emergency responses.
That alternative would be to get into hard places, or like for example the last snowstorm, we would use that vehicle to access patients, and all patients really, but not just opioid, but also opioid patients.
But he could not recall a time it's been used in response for an overdose.
I don't have an exact specific example for you, unfortunately.
First Alert 4 Investigates asked the mayor, deputy mayor, a long-serving council member, and the city attorney to speak on camera to explain this opioid settlement spending. Only the mayor and council members called us back, declining interviews, but over the phone say they don't remember allocating the roughly $70,000 last year.
This is money that people died for.
Local drug policy expert Chad Sabora says most of Kirkwood's opioid settlement spending falls under general public safety and is not specific to opioid issues.
Lots of people have been hurt and their lives have been destroyed, and we owe them better.
It's unclear if Kirkwood consulted with any experts or people with lived experience. Both Sabora and Buckner say there is still time to better invest what money remains.
They could have invested in a city education program for overdose response for bystanders. They could have set up some naloxone distribution points.
People are dying from this every day, so it's never too late, but it should be done.
Now, we did try to find out who's responsible for making sure opioid settlement spending is used appropriately. The Attorney General office tells us that while it did help get the settlements across the finish line, it does not play a role in enforcement and referred us to the State Department of Mental Health. The spokesperson there says the department does not enforce the terms of the settlement agreement. So right now it's unclear what checks and balances exist for millions of dollars yet to come for local cities and counties. By the way, Kirkwood is projected to receive an additional $327,000 over the next 13 years. It's not about a $30,000 expense. The state auditor says it's about the principle of how this money is being used and the lack of oversight to manage what we've discovered. We have asked questions and got FaceTime with Missouri Auditor Fitzpatrick, who says a new investigation now underway will find that answer.
The work that First Alert 4 did to bring this to the public's attention is a big reason why we're involved.
That's Missouri Auditor Scott Fitzpatrick, who is now launching an investigation into the spending of money intended for opioid treatment and prevention after First Alert 4 Investigates uncovered a questionable expense.
It's hard for me to imagine a very good explanation for how the snowplow falls into any of the allowable categories of spending that money.
We told you in March, Kirkwood allocated $30,000 of its opioid money to help buy a snowplow for its fire department.
Doesn't make any sense.
A discovery upsetting for this resident who lost her son to an opioid overdose.
I think it should be put back and use what it was intended for.
Local drug policy expert Chad Sabora says most of Kirkwood's opioid settlement spending of its $70,000 falls under general public safety and is not specific to opioid issues.
This is money that people died for, and lots of people have been hurt and their lives have been destroyed, and we owe them better.
Our report also getting the attention of U.S. Senator, then former Missouri AG Eric Schmidt, who finalized that settlement.
That does not sound like a good use of dollars.
Just this week, State Auditor Fitzpatrick sent this letter to Kirkwood Mayor Liz Gibbons, asking her and the city to hand over any relevant documents about the snowplow and other expenses involving opioid money.
It's not just the truck that we're looking at. We're going to look at all their expenditures. We've asked them for explanations of how each of those things do relate to the opioid settlement and how they're allowable, the explanation of how they're allowable uses of those funds.
2 years ago, state settled a lawsuit against makers and distributors of opioids. The deal was to pay damages to the states. A 2023 Missouri law states the money shall only be utilized to pay for opioid addiction treatment and prevention services. Fitzpatrick tells First Alert 4 Investigates the law fails to identify penalties for incorrectly spending the money.
What is the consequence? It's not outlined in the law.
It's not, but I think administrative penalties would be that you're not eligible for further settlement funds.
The issue First Alert 4 Investigates is digging into is a lack of oversight. Both the Attorney General's office and the Department of Mental Health say they play no role in enforcement. Fitzpatrick says he hopes his investigation will answer that question.
The process by which you know this thing arrived in our lap was kind of like a hot potato, right? Didn't the Attorney General's office and the Department of Mental Health both say that that their job was not to do any enforcement?
The auditor says there are other possible investigations, and if enough issues to establish a trend, a larger scale audit could be appropriate.
We don't have enough people, enough time to go audit every city that received these settlement funds. So we would need to go at it from the Department of Mental Health angle and look at the oversight they're providing to how this money is being spent.
This is a result of months of asking questions, filing requests for information not openly made available to the public. Now, we did reach out to Mayor Gibbons to confirm she has received the auditor's letter. She has not responded. Because of the law not defining penalties for misuse of spending, it's really unclear what consequences a municipality would face. The state auditor did suggest a local government could be required to pay back the state or forfeit future funds. For example, Kirkwood is projected to gain another $327,000 over the next 13 years. We are digging into other government spending with this money, and we will continue to ask questions and update you as we uncover possibly other questionable expenditures. For First Alert 4 Investigates, I'm David Amelotti. All year, First Alert 4 Investigates has been digging into how opioid settlement money is spent in your community. We found Kirkwood used $30,000 of its money to buy a snowplow for its fire department with no record it was ever used for opioid response. And we discovered no one is making sure this money is spent correctly. Our reporting prompted a state investigation, and now the Missouri auditor says the purchase is a stretch and wants lawmakers to step in the new year.
Nobody's watching how this money is being spent.
Missouri Auditor Scott Fitzpatrick says he has big concerns after wrapping a 6-month investigation into opioid settlement spending and a lack of oversight statewide.
You guys did a lot of investigation on the front end, and so we had a pretty good roadmap of what to look for and what to look at.
First Alert 4 Investigates told you back in March, Kirkwood allocated $30,000 of its opioid dollars to help buy a snowplow for the fire department.
No, it doesn't make any sense.
A discovery upsetting this resident who lost her son to an opioid overdose.
I think it should be put back and used what it was intended for.
Auditor Fitzpatrick says Kirkwood's original justification for the plow is completely inapplicable.
They have no records indicating that they ever used this snowplow in that way for responding to a medical emergency or an overdose emergency.
Inside the report, the auditor says Kirkwood used opioid settlement money to cover half the cost of that Ford F-350 truck without city council approval and without sufficient documentation to support the purchase. The auditor says once his office started asking questions, the city changed its story. What Kirkwood reported to the Department of Mental Health differed from what it told investigators. And when asked for proof the truck and snowplow were used in emergency response, city officials couldn't provide any dispatch records. They said the vehicle wasn't included in their dispatch system like other emergency vehicles, but have since added it for better tracking. Ultimately, the auditor found the connection to opioid remediation tenuous at best.
It's not just a blank check that people can use for whatever they want.
We found the expenditure through the Department of Mental Health's public reporting website. But when we asked about oversight, we found there is none. Following the auditor's report, Kirkwood Mayor Liz Gibbons tells First Alert 4 Investigates the city of Kirkwood remains committed to using opioid settlement funds effectively to address the opioid epidemic and enhance community well-being. The city is adjusting its procedures in accordance with the auditor's recommendations to ensure direct city council involvement in the approval, tracking, and reporting of settlement expenditures. The bigger issue, as First Alert 4 Investigates first exposed, and the state auditor now confirms, no one is making sure opioid settlement money is spent the right way. That money comes from lawsuits over drug companies that fueled America's overdose crisis. Hundreds of millions of dollars are flowing into Missouri and across the country as tens of thousands of people die each year from addiction. Right now, the state's mental health department only collects reports on how cities and counties spend the money, but doesn't verify it. The auditor says that needs to change.
How do you hold that local government accountable?
I do think the Department of Mental Health probably has the authority to make a determination if funds are not used according to law and require the entity to repay them.
To make the change, it requires the state legislature to make a new law, amend the current law on how this money is spent, or convince DMH to take on enforcement so funds can be clawed back if misused.
How soon do you want to see lawmakers act? Is this something that you feel needs to be addressed in the upcoming session?
I think that starting in January, that the legislature should look into this and work on it and hopefully have something in place when they leave in May.
We have asked the Department of Mental Health for comment following this new report. In May, DMH told First Alert 4 Investigates it handles the public reporting, but not spending oversight. This is an ongoing issue impacting thousands of Missourians. We will continue to follow. For First Alert 4 Investigates, I'm David Amelotti.
First Alert 4 investigator David Amelotti is putting you first, asking how this is helping in this epidemic.
Nick was so full of life. He had the best sense of humor ever. He was always a practical joker.
St. Charles County resident Jill O'Toole says her son's struggles with addiction started at 14 and escalated to meth and fentanyl after landing a factory job out of high school.
His personality started to change. He wasn't hanging out with us anymore.
She says his struggle in and out of the ER and rehab continued for years until January 22nd, 2020, where he died at home, tragically alone with no one nearby to administer the Narcan inside the house.
I relive that day over and over in my mind constantly.
O'Toole says Nick's death is one of the many examples of young people losing their life to opioid addiction in St. Charles County.
When my son passed away, he was 21 years old. By that time, he had already been to over 20 friends' funerals, all from St. Charles County.
That's why she advocated for the opioid settlement funds in Jefferson City 2 years ago.
There's a huge need in St. Charles County for this money.
But she says funding death investigator salaries doesn't solve the epidemic.
Absolutely not. It's infuriating that that's what they're doing with it. That is not what this money is intended for, and that's not what everyone fought for this money for.
The state and local governments that get these dollars are bound to terms in the settlement, meaning they have to spend the money to address treatment and prevention. It's also state law. First Alert 4 investigates through records requests. Learned St. Charles County used $148,000 to pay part of 2 death investigator salaries. The county claims the expense is allowable here by filing it under treatment connections to care. County Executive Steve Ellman tells me it's justifiable.
How exactly are death investigators, in your eyes, helping with treatment and prevention?
They can bring up information, may help the police find the dealers. They talk to people and may find out there's other people in this group of young people who are using drugs. If you can find out more about the supply and shut it down, that's certainly, I think, a legitimate reason to spend this money.
Ellman says each ask went through the county lawyers to best ensure projects are in compliance.
There may be better uses, and we're always open to suggestions about when you go talk to everybody else about this, think somebody else has got a better use of it, give me a call.
When I hear about it being filed under treatment, that's a bit of a stretch.
That use of funds not sitting well with Dr. Fred Rutnick. He leads the Addiction Medicine Fellowship at St. Louis University. He's also a leading expert in how opioid settlement money should be spent.
Unfortunately, it's really tempting to use opioid litigation funds to plug budget gaps because that's what we've done in Missouri with tobacco settlement funds.
Rotnick says he's worked with the medical examiner's office in St. Charles County. He says their work is important, but does not qualify as treatment.
They do good work in terms of tracking overdoses, particularly opioid overdoses. However, calling it treatment is really not what is generally considered treatment in healthcare, and particularly with opioid settlement funds.
He says the priorities for this money needs to be medication-assisted treatment, identifying why people use opioids, and school-based, evidence-based programming around prevention to reduce harm.
I would love us to really keep an eye on how these funds are being spent.
That's the question First Alert 4 Investigates continues to ask. Who is watching these funds and enforcing how the money is spent?
Sometimes we get asked questions and we point them to the allowable use list that is on the public website.
That's Lori Strongecki, the state's opioid settlement reporting coordinator with the State Department of Mental Health. That agency created this website to provide uniform reporting for all Missouri entities receiving settlement funds.
To my knowledge, there is no requirement or parameters for the Department of Mental Health to police the expenditures after they've been made.
But neither DMH or the Attorney General's office claim responsibility for enforcement.
We would hope that all entities are spending the funds to help those who have struggled or are struggling with opioid use disorder.
I think the stigma is one of the biggest things that affects everyone who suffers from substance abuse disorder.
On this day, that would have been Jill's son's 27th birthday, she's volunteering with Mo Network in St. Louis City to serve lunch to those battling addiction. She says launching a program like this in St. Charles County would be a far better use of opioid settlement dollars to boost treatment.
Dead people can't recover. You can't find recovery when you're dead. We need to keep people alive. Funding a death investigator is not what this money is intended for.
St. Charles County is slated to receive another $11.8 million over the next 13 years. Other expenses, St. Charles County has funded a teen drug summit and a certified peer recovery specialist at the jail. The county has $2.3 million budgeted to expand the Justice Center to better treat dozens of inmates struggling with opioid addiction at any time. Right now, Missouri Auditor Scott Fitzpatrick is investigating a different use of opioid funds following our report about the city of Kirkwood spending $30,000 to help buy a snowplow. The auditor's office tells us that is still under review. First Alert 4 Investigates has told you for months about tens of millions of dollars to fix this epidemic. And what we've learned is some local governments across St. Louis are sitting on that money. Others have spent it to cover questionable expenses. Tonight, for the first time, we're speaking with a victim of overprescriptions, Mike Woods, who is going up against Big Pharma for his compensation.
They barely knew.
This is Mike Woods.
Barely knew.
The St. Charles County resident spent his career teaching middle school in the Francis House School District. Now retired, he wants to spend more time on the golf course and hitting the road with loved ones to see more games in person.
You got to see my leg.
But 20 years of various surgeries for his leg and back,
Nerve decompression, broken leg, knee replacement,
fueled his need for relief, now making this stage of life hard to enjoy.
Opioids were, prescribed 15, 20 years ago. They were just spit out, with like candy, at least to me they were. And it was just an easy get. And if I could have 5, why not have 10?
Woods got his latest prescription with 28 pills, but less than a day in, he's already taken 11.
They'll run out before they're due to run out.
And does that give you anxiety?
I just know I've allowed myself 3 to 4 good days, out of the 7.
Mike says he needs more drugs than the average person because from his 30s to his 60s, he's gotten these prescriptions, increasing his tolerance, forcing doctors to prescribe stronger and stronger doses to ease his pain.
If you took 2, I would take probably 5, 2.5 times probably what your amount is.
In recent years, regulations have tightened the grip on meds so that free-flowing supply of opioids was cut off, leaving people like Mike in a bind to manage pain and function.
And then you can have it.
He is now suing Purdue and Endo, he says, to hold these companies accountable. And he says he's owed as much as $40,000 to $70,000 for 2 decades of misery.
But no amount of money compensates you for the pain and the struggle.
No, not at all, not at all. What I really want out of this is some type of a mechanism that gets me better pain relief through legal matters. That's all I want out of this, and that I don't have to jump through 17 hoops to get in line to jump through another 17 hoops.
Starting in 2019, a handful of pharmaceutical companies, including Purdue, Endo, and Mallinckrodt, filed bankruptcy because of thousands of lawsuits blaming them for fueling the opioid crisis, forcing them to pay out billions of dollars. The issue is these companies have taken years to restructure, leaving people waiting for compensation Mike says they're entitled to.
There's got to be more people like me out there.
Mike is one of 135,000 people across the country who have filed a claim following Purdue Pharma's bankruptcy settlement. Most are suing for their addiction or the death of a loved one.
This is barely lowercase j justice.
Christine Minhey is a national leading expert on opioid settlements.
When we look at the monies on the table, which are totaled at, over $57 billion now, less than 2% of it will be going to individual people, and the grand majority, like almost 100% of it, will be spent by governments.
The attorney by day spends her free time cultivating the nation's most accurate tracker of these dollars in hopes they are spent to bolster public health response to drug use. She points out of that $57 billion, $7 billion is coming from Purdue. And not $1 has been paid out in almost 6 years as their bankruptcy drags on while victims wait for compensation.
Now they're kind of being presented with this, well, all the states have signed on, now it's time for you to say yes. And I cannot imagine the experience of having to do that.
Mike says he doesn't have to imagine. It's his reality.
This is just paperwork from Endo and paperwork from Mallinckrodt and paperwork from Purdue.
Wood says the filing process for the lawsuit is frustrating when these big pharma companies took years to settle, but he only gets a few weeks to prove his pain is real. Mike says the online forms are confusing, and he's worried he'll make a mistake, getting him kicked off.
You only get one chance, don't screw it up.
If you got Purdue in the room with you right now, what would you say to them?
They need to be held accountable. And I guess they have, but not until I see that money. Not until I see the money.
As for what's next, more than 600,000 claimants have to vote to approve Purdue's bankruptcy plan by September 30th. It's a plan already backed by all 55 state and territorial attorneys general. Endo is expected to be the first company to pay out starting this September out of a pot of $39 million, far less than Purdue's expected $900 million payout to individual victims. We're talking about $40 million in the bank across the St. Louis region. We found only 1/10 is allocated to treat and prevent opioid addiction, mainly fentanyl. Today, we're taking you inside the St. Louis County Jail for a rare look to see firsthand inmates overcoming addiction and how staff say outcomes could be better with more funding.
I was at my rock bottom.
For the better part of 20 years,
I kind of had no plan. I had nowhere to go.
Krista Fletcher says she has been in and out of jail struggling with addiction.
I became dependent on it. You get really, really violently ill.
She says her best chance at a sober lifestyle and a future outside these walls is completing the St. Louis County Jail's opioid treatment program.
I knew if I came to jail, my judge was not going to let me out eventually, and I was going to have to change something, and I really wanted to change.
Fletcher is currently in Choices, a 90-day drug treatment plan similar to the 12-step program, tackling substance abuse and anger management. We were there as inmates came through to get their daily pill.
It is Suboxone medication.
This dose gets them through the next 24 hours.
Under their tongue once it dissolves.
Krista gets an injectable for her opioid addiction. Treatment St. Louis County Jail staff provide to 100 inmates monthly.
We really offer this to everyone who comes in because it's going to lead to healthier individuals and a healthier community overall.
County Jail Medical Director Paula Oldig says more than 15% of inmates meet the criteria for opioid use disorder, with more than 50% of inmates having some form of substance use. That's 1 of every 2 inmates in the jail.
The difference that we see from someone who's been in jail for a day or two to the change when someone's been here for a couple months and been in the treatment program, it's like a brand new person. It really is amazing.
Oldig says this program is a model for more than a dozen jails in Missouri and beyond, offering open enrollment, screening everyone who enters this jail.
Why doesn't every jail just do this?
Money, time, resources, and to some degree education.
St. Louis County isn't lacking available money to respond to the opioid crisis. We first told you in February the county has accrued more than $16 million from the National Opioid Settlement. At the time, County Executive Sam Page told me the money was sitting in a high-yield interest account.
Is there not a current plan in place?
No, we're still listening to everyone.
Then weeks later, the county jail ran out of money to provide injections for inmates. Instead of turning to the untouched opioid money to restock the shelves, Page requested the funds come from the general revenue amid the county facing a $45 million deficit. He tells First Alert 4 Investigates he was following precedent.
Good evening.
Oldig herself testified for the release of funds, saying lives were at risk.
We physically cannot get to all the people that need this help. And as a physician, I mean, this is unconscionable.
Oldig says the back and forth cost 40 inmates to go untreated for their addiction. First Alert 4 Investigates asked Page why it took 4 months before he and the council dipped into those opioid settlement funds, allocating $1 million to buy more injections for inmates.
What's your response to that? There's people concerned that lives are at risk here if this money isn't allocated.
We are moving quickly to process all of that, but the opioid overdose deaths in St. Louis County have actually declined considerably.
That's true. The latest data from University of Missouri St. Louis's opioid dashboard shows double-digit decreases in 2023 and the first half of 2024. Still, hundreds of people dying from overdoses in the county annually. We were there as the Justice Center received its new batch of shots
25
and got to work restocking the fridges with vital medication. Oldig says spending this money now can improve inmate success and recidivism.
Medication is going to be the first priority so we can get everybody who needs treatment. Next would be more staff to help the patients continue treatment, connect patients to care post-release.
For Krista Fletcher, she's set to graduate from Choices this week.
Yeah, I'm really excited.
She says it's her choice to break the cycle of her addiction.
Would you be having this path to sobriety in another jail, or how much credit do you give the St. Louis County Jail?
100%. I don't want to call a jail amazing, but it is. I haven't seen my kids in a long time because I distanced myself because I didn't want them to see me like this. But they're not getting any younger. They're just, and I missed out on so much, but yeah, it's really important.
Not only did Fletcher graduate from Choices on Thursday, she also completed her GED as part of that program. Now, the current supply of Sublocade, that injectable medication we talked about in the story, the county has enough for almost 10 months for roughly 100 inmates. The county's settlement dollars are in a high-yield account drawing interest, and Dr. Page tells us the interest is intended just for opioid treatment and prevention as well. St. Louis County is slated to receive a total of $45 million distributed over the next 13 years. But First Alert 4 Investigates, I'm David Amelotti. If you want a true picture of the public health issues where you live, look no further than your jail. That's what the Director of Corrections here in St. Charles County tells me. He says the majority of the inmates he's responsible for struggle with substance abuse and mental health issues. He says it is a stark reflection of a growing crisis in our community.
Once that first drug is ingested.
For St. Charles County resident Zachary Forgy,
it's game over.
Opioid addiction has been a lifelong battle.
You'll sell your mother for your next fix.
His addiction led to a string of bad decisions, including multiple DUIs, landing him in the St. Charles County Jail repeatedly. Zach's story is one of many, and it highlights a major challenge for the St. Charles County Jail: how best to treat inmates addicted to opioids and actively detoxing in custody.
Right now, St. Charles County falls short.
Director of Corrections Daniel Keene runs the St. Charles County Jail. He says the county simply doesn't have the space or specialized resources to meet the need.
We have an issue. 86% of our population, or 404 inmates right now, have some type of substance abuse and mental health issues. So yeah, I mean, from us, what are we going to do?
This isn't just a human cost, it's a significant financial burden on you, the taxpayer. For a jail to effectively act as a mental health facility, it's a costly business. St. Charles County estimates housing one inmate costs $114 per day. And with 470 inmates, 2/3 with substance use and mental health issues, the costs are substantial. That adds up.
Very much so.
This growing crisis, combined with new opioid settlement funds, pushed St. Charles County to find a new solution. The county is dedicating more than $2.3 million from its opioid settlement funds towards construction at the Justice Center. It's the largest local opioid settlement funded project in Missouri.
We're going to have cells along this wall here.
This is what the cell block looked like when First Alert 4 Investigates visited the construction site over the summer. And when we got back inside mid-December, crews now have cell walls in place, while they continue working on electric and plumbing. Keene says the expansion will allow the jail to treat inmates more effectively, providing structured programming and a dedicated housing unit for 62 inmates with substance abuse issues. This new approach includes evidence-based programs, peer support, and either daily doses or monthly injections to address opioid withdrawals.
We're attacking the problem. We're not going to be sitting back and seeing what we should do with it. We know what we should do with it.
The opportunity to start from scratch and to build based on best practices, that doesn't come by often.
Dr. Fred Rotnick, who runs SLU's Addiction Medicine Fellowship, says more local governments need to follow St. Charles County's lead.
People are dying every day from opioids. We need to get the money out the door.
Dr. Rotnick spent nearly 2 decades as medical director at the St. Louis County Jail. He says a medication-first model is essential, with treatment inside and continuity outside.
If we're able to intervene when folks are in a jail or prison or detention center, provide them the healthcare tools they need to be healthier, and they return healthier, not only does the individual benefit, but the family and the community benefits as well.
We need something like this because a lot of times people end up in jail. They can't wait to get out and get their first fix.
For Zach, he continues to go through the county's treatment court. His work to get sober means getting time back, time to make memories with loved ones, like his niece.
I'm so glad that I get to see what that little kid grows up to become.
His hope is this new expansion at the St. Charles County Jail gives others struggling with addiction the same chance.
How important is it for an addict to get that second chance?
The most important, because it could be their last.
St. Charles County has developed most of its inmate programming internally. Director Keene says there's a good chance that there'll be collaboration with neighboring counties in the future. The entire jail expansion should be online by the end of August 2026. Now, there's other ways that St. Charles County has spent its opioid settlement dollars: a teen drug summit, a jail peer recovery specialist, and 2 medical examiners specifically investigating opioid deaths. In St. Charles County, David Amelotti, First Alert 4 Investigates.